In a world where well-being takes center stage, we introduce a luminary figure and true pioneer in natural health and wellness, who has transformed countless lives with his natural health expertise and holistic approach. Introducing Aaron Warden, also known as the Juice Doctor. The Juice Doctor is an award-winning clinical nutritionist, natural health researcher, detox specialist, and functional health practitioner. He's a trailblazer, an innovator, and the producer of botanical health products. You may recognize him as the star of Channel 4 and Sky TV's Supersized Kids, where Aaron took a 26-stone teenager on an emotional roller coaster to transform his life and ultimately his weight. As a social entrepreneur, humanitarian, CEO, and founder of Vivo Nutrients, Go Detox, and MI Healthcare Group, the Juice Doctor is committed to providing natural health solutions that produce real results. His mission is simple: freedom through well-being. Join us for an extraordinary and insightful well-being experience as the Juice Doctor takes us through the award-winning wellness blueprint that has successfully helped thousands achieve natural weight loss, increased energy, amazing mental clarity, glowing skin, and overcome major health challenges without medication, bad diets, or stepping into a gym. The Juice Doctor's approach to wellness is revolutionary and cuts through uncertainty by thoroughly examining all aspects of your health and lifestyle. Once the root cause is identified, nature's finest organic ingredients are employed to create an inner environment conducive to accelerated well-being from within. Don't miss this life-changing opportunity to transform your life and inspire a new perspective on health. Bring your health-related questions and get organic recommendations and enhanced food-based solutions that will supercharge your health like never before. Book in for a non-invasive scan and consultation today and get ready for a transformative experience that will exceed your expectations. Your journey to holistic optimal wellness starts today. Make sure to follow the Juice Doctor on Instagram at ask.juicedoctor and on YouTube at askjuicedoctor.
So you want great health, optimum vitality. With health being a global priority and inflation skyrocketing, time and money matter more than ever. So start working smarter, not harder. Introducing OxyFlush by My Healthcare Group. Natural health solutions that provide real results. You see, great health begins in the gut. In fact, the father of modern medicine, Hippocrates, said all disease begins in the gut. Over 70% of your immune system is also in the gut, so it's critically important to keep this area in optimal condition. OxyFlush helps quickly remove accumulated waste and associated toxins from clogging up the colon and preventing proper absorption of nutrients beneficial to your health. The impact is felt body-wide as immune cells are freed up to attend to other areas in need of attention. So, working smarter couldn't be easier. Clean your colon, lose weight and show off the healthier you. Powered by My Healthcare Group, makers of OxyFlush.
I'm a bit of a perfectionist when it comes to sharing slides. I like to make sure I have the right one. Share. Okay, here we go. Thank you so much for your patience. Right, let me enlarge that. Okay, so we're going to cover a little bit about benign prostatic hyperplasia, BPH for short. We're going to look at PSA, prostate-specific antigen. We're going to look at what is prostatitis and what is prostate cancer. So those are things we're going to cover today in today's presentation. So let's start off with some of the risk factors. What are the risk factors for having prostate issues? The first one is your age. It increases with your age. So as you get older, your risk for developing benign prostatic hyperplasia increases. It also increases if you have a family of prostate issues. It also increases if you have a problem with obesity, if you have too much weight, or you're carrying too much weight, it's going to put a lot of pressure on your prostate and the function of the prostate. Also, if you already have diabetes, you haven't got your blood sugar under control, that's also going to have an impact on your risk of developing prostate problems. If you have high blood pressure, if you're hypertensive, it's going to increase your risk for developing issues with your prostate. Also, if you smoke, if you're a person that smokes. Now, statistics say 1 in 4 black men, so if you're a black man, you're a much higher risk of developing prostate cancer. And they say that 1 in 4 black men will develop prostate cancer in their lifetime. And they're more likely to get it more than other races who have a 1 in 8 chance of getting prostate cancer, the same disease. The reason is unknown, but we've been doing a lot of research on why that is actually happening and how it's actually presented itself within the black community. Some say it's linked to genes, but there are a number of different hypotheses as to why that may be taking place. Studies have shown that prostate cancer in black men have a different genetic profile, so it may well be a genetic thing to do with the mutations that they have. They occur at a much more aggressive rate. So when they discover prostate issues within black men, it tends to be at a more advanced stage. So these are things that we're looking at, and we're conducting some ongoing research into why that happens. We've come up with some really interesting findings so far. We've been really able to utilize it to some great effect, helping a lot of people. So let's look at some of the BPH symptoms and what the BPH looks like. What is actually benign prostatic hyperplasia? So some of the most common symptoms of BPH are frequent urination. So if you're a man and you experience frequent urination, or you're a woman and you see your husband going to the toilet a lot more frequently than usual, there may be a clear sign that he may be experiencing some kind of prostate irregularity, especially at nighttime. If he's waking up in the nighttime, 4 or 5 times to go to the toilet, it could be a sign that he's maybe experiencing some issues with his prostate. Also, if he has a weak or slow urinary stream, so if you're a man and you take a bit of time to start, you find your husband's taking a long time, or your partner or your dad's taking a long time to wee, because that means they may be taking a bit of a longer time to start to wee and a longer time to finish at the end, so they may have a slower urinary stream. They may also have difficulty starting or stopping urination, or feeling of incomplete bladder emptying. And we'll talk a bit more about why that happens as we proceed through tonight's discussion. You also may have a feeling of dribbling after urination. So if you're dribbling after urination, that's another sign there may be some issues with your prostate. Also, if you have UTIs or urinary tract infections, a clear sign of a UTI is that you may have a level of burning when you go to wee, which means bacteria has been trapped in the urethra. And as its body's trying to eliminate the waste, some of these bacteria are starting to get caught in the urinary tract, which is causing that burning and stinging sensation. Lastly, you may also have some blood in your urine. If you see blood in your urine, that's a clear sign that something is wrong and it's time to get yourself checked. Let's look at this, what a healthy prostate looks like and a prostate that is enlarged looks like. So you can see on the left, the prostate is normal. As you can see, the arrow is pointing to the prostate, which is the gland which sits on either side or behind the bladder. On the right now, you can see a prostate which is enlarged, a lot bigger. It's just below the bladder, but you can see the urethra, because you've got the bladder that will fill up like the reservoir that holds the urine, and you can see the bladder with the urethra, which is the pipe that the body uses to eliminate the urine and the waste material through that pathway. If the prostate is enlarged, it will put a lot of pressure on that particular organ, which will then result in you having increased urination. So when you have a diagnosis, if you have a diagnosis of benign prostate hyperplasia, there are different ways that the doctors will identify or arrive at that stage. And one of them is by doing what they call a DRE, digital rectal examination, to check the size and feel of your prostate. This is what they use. I don't really agree with it because it's quite invasive, and it's only gives you like a small part of the picture. Because if you imagine you've got a big orange, and they use their finger to insert into the uranus, and they feel one part. Imagine you feeling one part of the orange. You're only going to get to feel that part of the orange. What about the rest of the orange? Maybe that part of the orange is a little bit enlarged, or a little bit dented, or a little bit inflamed. It doesn't really give you a full picture. So I don't know why they use that as a means of identifying if the prostate is enlarged. There are so many other ways that you can use, or so many other measures that why they have to use that such an invasive and derogatory way. I don't understand till today, but that's what they use as a means of checking the size and feel of your prostate, even though you're only going to give you just one side or one perspective of the prostate. They also do a urinalysis, which will check for blood or infection in the urine. They'll do what they call a PSA test, I'm sure some of you have heard of, or some of you may have had, which is a prostate-specific antigen test to measure the blood levels of prostate-specific antigen. Again, this is not conclusive because your PSA could rise for a number of different reasons. It could rise because you have high levels of inflammation. It could rise because you have an infection. There's so many reasons why the PSA could rise. So it's not a conclusive picture in terms of trying to understand what your state of risk is regarding your prostate. But it's something that's used, and the more information, the more aspects that we have, is the better you can use in forming an overall picture and maybe providing some sort of diagnosis or even prognosis of your situation. They also do uroflowmetry, which is to measure the strength and flow of the urine from the bladder. As I said earlier, if the bladder is under extreme pressure from the enlarged prostate, that's going to restrict the flow of urine through the urethra. And then lastly, they may do a cytoscopy, which is a direct look at the urine bladder and the urethra, because these are all linked as the organs that are related to the prostate. We do a non-invasive prostate health scan that we find is a lot more, well, it's a lot more friendly, user-friendly, it's a lot more dignified, because we use our non-invasive scan, which they said is done through your hand. If you see the report in the picture here, it gives you like a prostate analysis report card where we'll be able to get an idea of your level of hyperplasia of your enlarged prostate. We can also look at the levels of calcification, because sometimes your prostate is enlarged. Why is the prostate enlarged? Sometimes it could be calcified, so there could be some issues of calcification. So you can get a picture of what's happening with the levels of calcification. And then we can also get a look at your level of inflammation. We can see if your prostate is inflamed. And because we have the understanding that sometimes when you have prostatitis, it's often caused by bacteria, our research has also helped us to identify some of the actual bacteria that are commonly present when men experience prostatitis. I actually put a bulletin out for all the men in our networks to come and get their prostate checked using our reproductive and male health scan, and which we said is done through the hand. And a gentleman came, and it's quite interesting, when we did his scan, we saw his prostate, all of his levels, his markers were in the red on the right. So just so you know what we're looking at, in the green is where it should be, that's normal. In the middle, if it's in the blue, that's a little bit high. If it's yellow, it's a little bit more pronounced. If it's red, then it's quite severe. And both same things happen in the other direction. So we looked at his prostate hyperplasia, it was in the red. We looked at his calcification, it was very high in the yellow. And his prostatitis at the bottom was also in the red, so he was extremely inflamed. So having conducted this ongoing research, we wanted to find out what are the bacteria, because we're trying to find out why is it that black men always have prostate cancer discovered at a very advanced stage. So we wanted to find out what are some of the biomarkers that are present when these diagnoses are made. And one of the things that we found was that there are a number of bacteria that are always present, or quite commonly present, when men have advanced prostate cancer. And one of the bacteria, remember, was a bacteria called Pseudomonas aeruginosa. Another one was called Escherichia coli, or you may know it as E. coli. Another one was called Klebsiella. And then, of course, you have H. pylori or Helicobacter pylori, which often gives doctors a bit of a scare because they think, oh my God, it's like a superbug. They haven't got any antibiotics that can really control that bug, because it's quite resistant to antibiotics. But anyway, out of those 4 bacteria, he had 3 of them in his top 10 bacteria. I was like, wow, this is a really interesting indication. I wasn't taking any guesswork, or wasn't kind of taking any kind of stab in the dark as to what may be happening, but I was just taking the information that we'd gathered from the body, coupled with the research that we had and our own basic understanding of what may be happening down there. And he had a lot of the other markers that were out of range as well. So he was also having high levels of urination. He was having a lot of pressure of the prostate on the bladder, so he was frequently urinating. He was having trouble starting, trouble ending. So there were a lot of markers, but it was just interesting to see the bacteria that had been identified as risk factors for people with prostate cancer were all quite present in his body at that particular time. So the non-invasive scan really helps to provide a really detailed picture, to give a lot more information, so you can make a bit of a better informed decision if you want to go and do a further examination with your GP or with your hospital. What are the treatments available once you've discovered your status? Well, there are a lot of treatments available. Obviously, we want to look at prevention first and looking at some natural ways, but let's just look at a wide spectrum of what's available. Firstly, you have maintaining a healthy weight, because we said obesity, it puts you at a higher risk. So if you maintain a healthy weight, doing things like regular exercise, avoiding smoking, and avoiding alcohol, because alcohol really triggers that the enlargement of the prostate. So if you're a person that drinks alcohol and you're a man over 50, you're in that very high risk state of developing prostate problems. Also, if you drink coffee, because caffeine is also known as a trigger and something that stimulates the development of prostate complications. So maintaining a healthy weight, regular exercise, and avoiding smoking and limiting your alcohol, as well as keeping your coffee levels or intake under control, especially caffeine. Also looking at medications, things like alpha blockers, which help to relax the muscles in the prostate and the urethra, making it a lot easier to urinate. Then you have 5-alpha reductase inhibitors, which help to shrink the prostate gland, or a combination therapy, which may involve both. And then lastly, they also have surgery. 5-alpha reductors are quite good. You have them in things like saw palmetto. They're in things like different products, different herbal products that they use out there, different plant-based formulas they use. They contain a lot of 5-alpha reductase to help reduce the size of the gland and reverse that whole process of it, expanding and spiraling out of control. Some other treatments that they use for people that have been developed or been diagnosed after developing prostate problems are surgery. And they have a number of different types of surgery that you may or may not be aware of. So let's look at a few of them that are quite common that they use on a regular basis today. Number one, you can see at the top is a TURP, a TURP, which is like a transurethral resection of the prostate, which is like a surgical procedure involving a cutting away of the section of the prostate. It removes excess prostate tissue using an electrical wire loop. So it's quite a general procedure that's done quite often. It's done under general anesthesia. So you have a general anesthetic in the hospital. You're in and out within 2 days, and it generally takes about 4 to 6 weeks for you to recover. Another one they use often is a thing called a TWIP, which is a transurethral incision of the prostate procedure, where they use it to treat urinary symptoms caused by an enlarged prostate. They make a small incision in the prostate gland to actually widen the urethra, because it's been quite compressed as a result of the prostate being enlarged and placing a lot of pressure on it and squeezing it, so to speak. So they do that procedure, that procedure to help to widen the urethra, to at least help you to release your urine a lot easier. They do that through an anesthetic done through the spine, or a local anesthetic. It's normally, a day treatment, in and out in the same day. Recovery time is about 2 to 4 weeks for that particular treatment. We also have another one called the laser surgery, which actually destroys the excess prostate tissue using a high energy laser. Oftentimes these treatments aren't always made available, but once you become aware of them today, you can ask your doctor or your urologist if they are in a position to make a decision on your treatment options. Make sure they give you all of these options. Don't just let them give you one or two, or say they want to just get you under observation. If they have these options available to them, and if they haven't mentioned to you, just mention it to them. Say, what about laser, or what about TWIP, or what about these other ones? They say, oh, yes, well, that's normally for, and they will explain to you what situations you could have access to that type of treatment. They do laser surgery, as I said, which is general anesthesia as well. Again, you see in and out, it's like a day treatment. You get in and out, but you'll be taking about 2 to 4 weeks to recover. Then you also have what we call WVT, which is like a water vapor, which is quite a good and very harmless. It's more harmless than some of the other ones that destroys the excess prostate tissue using a very high-powered jet to really flush it away. And again, it's done under local anesthesia, so you don't really feel that much discomfort. You don't need to be admitted to hospital for that. And your normally recovery time is generally between 1 to 2 weeks. So that is a very good thing to ask for if they provide that type of treatment. And then last, we have the PUL, UroLift, which places implants into the prostate gland to lift and hold the enlarged tissue out of the way. I think this is what Prince Charles had, or King Charles, Prince Charles had when he was admitted for his prostate issue. So again, that's done under local anesthetic, and it's generally recovery. You generally recover quite quickly within 1 to 2 weeks. So those are some of the treatment options that are available, or the surgical operational procedures that they have available. They may not always make you be aware, but at least you have that awareness now. So if you want to take a picture of this slide and you're someone who's suffering with prostate issues, take a picture of this slide. When you see a urologist, ask him about these options, if they are something that would be viable for your particular situation. Okay, so let's have a quick look at what the different types of prostate would look like in relation to prostatitis. So you have a normal prostate, again on the left, where the urine is flowing quite freely. You've got the kidney, the bladder, then you've got the urethra, and you've got the prostate behind there. The urine will flow down through the urethra When the prostate's at the right size, there's no impedance, the urine just flows quite easily, you have no discomfort. Again, you see on the right-hand side, the prostatitis, which is inflamed, slightly different from the enlarged one. The urine is compressed because it's now got a much narrower pathway to travel down because the bladder is under considerable, well, it's putting pressure on the bladder and the urethra. So the urine may not flow as freely because it's been, restricted by the inflamed prostate. And if you have an inflamed prostate and an enlarged prostate, then you're going to have even more problems. So it's really good to really try and be mindful of how you're managing your health, how you're monitoring your health. So sometimes you may just have an infection, which will lead to prostatitis, an inflamed prostate, or you may have an enlarged prostate, and both. The more problems you have, and the more you're not really taking note or doing regular checks or making sure you're keeping your health in check, is the higher you place yourself at risk of these problems developing into prostate cancer. You can have an enlarged prostate and not have prostate cancer. You can also have prostatitis or an inflamed prostate and not have prostate cancer. So don't just think because you've got an enlarged prostate, oh, you're automatically going to have cancer. Because they'll say as you get to a certain age, you're going to be more prone to having an enlarged prostate, especially if your levels of zinc are quite low and not maintained. So let's look at some of the prostatitis symptoms. We looked at BPH symptoms, look at the benign prostate hyperplasia when you have an enlarged prostate. Let's have a quick look at some of the inflamed symptoms when you have a prostate or inflamed prostate, as we call it, prostatitis. Anything itis that you hear in the medical community basically means inflammation. So when you have prostatitis, it means inflammation of the prostate. You have sinusitis, it means inflammation of the sinus. Anything itis just basically means inflammation preceded by the organ that's inflamed. So the first thing you'll notice in prostatitis is that you may have pain or discomfort in your groin area or your genitals. That's the first sign that you may have inflamed prostate or prostatitis. Secondly, you may have the frequent urination, which is similar to the enlarged prostate. But another clear sign that you may have prostatitis as opposed to enlarged prostate is that you may have the burning when you go to wee. Some people think you only get that when you have a STI or a sexually transmitted infection. But oftentimes, if you're not sexually active and you still find yourself having a burning when you're urinating, that is a very high sign that you may be experiencing inflammation in your prostate, which is generally caused by infection, again, which is, as you mentioned earlier, I think, to some bacteria. Difficulty urinating, if you have painful ejaculation, if you have blood in your semen, and if you're experiencing erectile dysfunction. These are all linked to having a high level of inflammation in your prostate. What are the common causes of prostatitis? Well, it's largely unknown, but suggested causes include, as you mentioned earlier, infection. That's why we kind of did a bit more of a deeper, in-depth study on bacteria, in which bacteria are more present when they do have prostatitis, and we're able to actually pinpoint and identify the specific strains of bacteria, so we can then isolate them and identify them as key progenitors in that type of situation when a man is faced with any kind of test. If we see high levels of that particular bacteria, we know that this could be a high risk for something a little bit more sinister. So infection, also autoimmune conditions, chemical irritants, and if you have sustained nerve damage to your pelvic area. So you've got to really be careful about how you're managing your exercise, your lifting. If you're a person that's always in and out doing a lot of manual work, be careful how you lift or you bend or you do whatever technique they've shown you to make sure you're adopting the correct posture. What are the prostatitis main causes? We looked at some of the symptoms. Let's look at some of the causes. So now they say there's 4 main types of prostatitis causes for that particular condition. One they call ABP. What is ABP? ABP basically stands for acute bacterial prostatitis. It's a bacterial infection of the prostate that generally causes sudden severe symptoms. It's quite rare, but it's a very serious condition that requires prompt medical attention, especially if the bacteria and the strains of the bacteria are things like Helicobacter pylori or E. coli, because Helicobacter pylori, it causes a lot of problems. It causes ulcers. It can affect the whole of the body. It can affect your heart. It can affect your brain. It can affect multiple systems within the body. So if you do have a prostatitis and you get severe pain from having that infection, then you really want to get that looked at and checked out straight away, because it can lead to further problems further down the line. Also, CBP, another possible cause, is chronic bacterial prostatitis. just so you know, we like to keep things simple so that people can always understand when they use these kind of medical terms. When they say things like acute, it just means it's mild. It's not really been there that long. It may have just started recently. When you start talking about chronic, you're starting to go into the Latin and Greek words coming from the Greek word chronos, which relates to time. So when you say you have a chronic disease or a chronic infection, it just means you've had it for a longer period of time, which means it's had a lot longer to develop and maybe progress into further complications. So chronic bacterial prostatitis basically means it's like you had it for a long time, and it's a recurring bacterial infection that's happening over and over again. And it can lead, it can cause less severe symptoms because than an ABP, but it's more common than ABP, but it can still be difficult to treat because it comes and goes. That's why they call it chronic, because it's been there over a longer period of time. With a chronic prostatitis or chronic pelvic pain syndrome, they call it CP or CPPS. It's the most common type of prostatitis. It causes ongoing or recurring pain in the pelvic area, as well as urinary tract symptoms, such as the frequent urination, the burning urination, and difficulty urination. So these are the long-term issues that you've had. If you've experienced these issues over a long period of time, then it's time for you to really take some action. Don't just ignore it, think, oh, I'll be all right, it will go away, because it goes away and you're not feeling it for that particular day or that particular moment. Don't just assume that it has disappeared completely, because you have a thing called an immune system, where your immune system is constantly working and battling to overcome any kind of abnormalities within the body and trying to bring back balance and order and return homeostasis wherever it is possible. Then the last one is asymptomatic inflammatory prostatitis, which is AIP for short, characterized by signs of an inflamed prostate gland, which doesn't have any symptoms, and it's also a quite uncommon type of prostatitis. So it's basically when your prostate is become inflamed, which may be for a number of other reasons other than the ones you mentioned earlier. It may not be caused by infection. It may be caused by toxins that are released into the blood or released into the area. Again, if your bowels are regularly, if you clean your bowels regularly, this again could have an impact on reducing the risk of these things, because the bowels and the prostate are all kind of in the same kind of area. So if you have a problem with constipation, or you don't really empty your bowels regularly, again, you're going to allow for a buildup of bacteria in your colon, which could then also trickle down into the prostate area. So you've just got to be really careful and mindful of your diet, having met the right levels of fiber. Make sure you're going regularly. Don't think it's, I know a lot of women think, I don't want to go to the toilet in public places. I don't want to go to the toilet when I'm at work. But these things could lead to further problems. It could also affect your uterus, and it could also affect your ovaries. So let's, when your body says it wants to get rid of waste, let's release that waste and let's not keep it in, because it's better out than in. It's doing a lot more damage when it's in than it being out and flushed away. So what's some self-care advice that we can take if you're suffering with prostatitis? Number one, practice good hygiene. This includes washing your hands regularly, avoiding sexual intercourse with someone who has a urinary tract infection, because that means you're going to come into contact with that bacteria that they haven't been able to get on top of, which is now going to be exposed to your member and your weakened immune system, which will put you at further risk. So making sure you're mindful of your sexual activities and your conduct in that regard, to make sure you're not putting yourself at risk through your copulations. Also, drinking plenty of fluids. Fluid is really key to every aspect of health. If you drink a lot of water, it's going to help you to flush out the bacteria from the urinary tract, because the kidney is always going to be working to remove and filter out any impurities or any bacteria or any toxins from the blood. By you drinking plenty of water, you support those systems, you support those organs, and you support the function of those organs to make them be able to operate more effectively and more efficiently. This goes for men and women. So the more you drink is the more your kidneys are going to operate more effectively and efficiently to remove things that are ready to be ejected from the blood. So by you drinking plenty of water, you support that process and aid your body to get rid of things it no longer needs. Another big irritant is caffeine. If you drink coffee on a regular basis, especially caffeinated coffee, you need to really cut down your coffee intake, because it's really going to have a significant effect on your prostate health and your prostate well-being. Alcohol is the same, and spicy foods, as these can also irritate the prostate. Make sure when you empty your bladder completely, because this will help to prevent bacteria from building up in the bladder and prevent or reducing your risk of developing any kind of UTI. Because sometimes people have a UTI. It may only last for a day or two, but if you just increase the water, sometimes adding a little bit of cranberry juice, These things all help to really, flush through the kidney, flush through the bladder, and to flush through the urethra, and to make sure any bacteria that may be hanging around don't get to really build up and form any kind of, dangerous colony in that environment. Emptying the bladder completely will help prevent the bacteria, and also using a warm compress or doing relaxation exercises. And also make sure you do regular checkups, come to see your GP, come to see your naturopathic doctor, whoever is responsible for helping you to maintain your health. You want to make sure you're keeping good contact with them to make sure you're checking yourself, especially as you get into those ages of the risk period. When you start to go over 45, over 50, you really need to start checking in regularly with your GP or your naturopathic doctor or your integrated functional medicine practitioner like ourselves. We look at the body as a whole. We don't just look at one area. We look at the whole body as a complete unit, and we make sure we help you to make informed decisions that will support your overall health, not just from a health perspective, but also from a diet and lifestyle and your mental well-being and choices. So the Japanese people, for example, they don't go to the doctor when they're sick. They only see the doctor when they're well. If they have to go when they're sick, that means they've really, really let themselves go. So they really tend to be having a more proactive approach by being preventative as opposed to waiting until the fire started. So they always go to the doctor when they're well. That's a really great way to be, to make sure you check everything, to make sure the things you're doing are working, and you're not going to be putting yourself at any level of risk of developing any conditions. PSA test. A lot of you have probably heard of the PSA and the prostate-specific antigen. What is a prostate-specific antigen, you may ask? It's a protein. It's produced by the prostate gland, which is a small walnut-sized gland located just below the bladder in men. Its role is to help to liquefy semen, the fluid that contains sperm. Small amounts of PSA, the antigen, normally enter the bloodstream, and PSA levels can be measured in a blood test called a PSA test. When you look at your PSA, when you do your test, it can actually be normal in prostate diseases, including cancer. This is why we say doing a PSA test is not an indication of you having cancer. You can have a PSA test and the results come back that your PSA levels are quite high. Doesn't necessarily mean you have cancer, doesn't mean you don't have cancer. It's just part of the matrix of information that helps you to make an informed decision. As it depends on the certain cells of the prostate producing the protein, because there's different cells that produce different proteins. So you need to just look at the whole picture as a whole and look at the whole of your overall health and other risk factors that we mentioned earlier. Are you expose yourself to those risk factors? Are you living that kind of diet, that kind of lifestyle? Do you have a very unhealthy diet? Do you have high levels of coffee? Do you drink high levels of alcohol? All of these things will contribute to the overall picture. So don't look at the PSA test in isolation. Then there's reason for limitations in using PSA. Is that they do a thing called mass surveillance, where they'll look at a number of different men and different groups of men and really help to kind of formulate some kind of range to see what, men that have a, specific background or specific age group or demographic, they may present with when they have a PSA test. It may represent this, that they generally do have cancer, or they represent they don't have prostate cancer. So they have different ways of using the PSA test, but it's not in itself an exclusive determinant of your state of your prostate. What does the PSA actually measure? It actually measures the amount of PSA molecules in a patient's blood. It's normal for all men to have some level of PSA in their blood. So if you go and have a PSA test, it's, oh, your PSA is high. They'd have to ask them, what range are they using? What is the range? So you can see if your level is above the normal tolerated range, because the body is always going to have some level of PSA in it anyway, then you can look at what the next steps are, what the risk factors are, and what the action that you may need to take. It can be raised for lots of other reasons, including a urinary or urinary tract infection. If you've done vigorous exercise, that could also be a reason for your PSA to be elevated. If you've had recent ejaculation, if you've had recent sex, or if you've had anal sex, that's also going to put your PSA at a much higher level. It could also be a result of other prostate problems, such as an enlarged prostate gland, as we said, the BPH. So if you have a raised PSA, it doesn't necessarily mean you have cancer. Your doctor should talk to you about your results and what they might mean, but you also need to be informed about what a PSA actually represents, what the levels are, what the level should be, and more importantly, what your levels are. So it's really good for you to have that knowledge, have that understanding, so you can have a really informed conversation. Otherwise, you go in there not knowing anything, and they can tell you anything, and you just get, really nervous and start to panic. Okay, let's quickly look at prostate cancer. Prostate cancer is a very common condition in especially the Black community, especially amongst our males. even across the world, really, not just in the UK, in America, in Africa, it's really becoming a worldwide problem. How are we able to identify prostate cancer, and what are we able to do to understand a bit more about the causes? Well, as I said, we're conducting our ongoing research, and we're really making some good headway. As I said, we've identified some of the key bacteria. We've also identified some of the viruses. One of the viruses we identified, actually 3 of the viruses we identified that were always present when men have advanced prostate cancer was HPV, which is human papillomavirus. HPV is a virus that's also present when women have cervical cancer. When they look at they do the smear test, they're actually looking for abnormal cells, but also looking for the presence of the HPV, or human papillomavirus. So it's quite interesting to note that from the studies, it showed that HPV is also one of the viruses that's also quite heavily involved in prostate cancer, especially advanced prostate cancer among Black men. HPV, also Epstein-Barr virus, was another one that was quite commonly present in advanced prostate cancer. And the third one, which was retrovirus HTLV1, which is like your T cell lymphatic system. So they say it's largely unknown, but the risk factors are they're quite high, especially among our community. But if nobody's going to do the research, we have to do the research ourselves, which we are doing. And as I said, we're making good headway, and we're helping to use that information to help men to make better decisions regarding preventing themselves from falling into that situation. So some of the causes or the risks of prostate cancer include your age, because it increases with your age. Most commonly men over 50 years old. As you get older, you become more at higher risk of developing prostate cancer. Your race and ethnicity, as you said, prostate cancer is more common in Black men than in white men. Hispanic men are also at an increased risk as well. If you have a family history, having a father or a brother who has had prostate cancer increases your risk of developing disease as well. Also genetics, if you have certain genes, such as the BRCA1 and the BRCA2, they could also increase your risk of developing prostate cancer. Your diet, eating a diet that is high in red meat, if you're a person that's a very, very avid carnivore, like you love your meat, you love your mutton, your lamb, your beef, your heavy, meat eating family where you come from, then you've really got to be careful, because that's going to really put you at a much greater risk of developing prostate cancer. If you have a high diet that's high in processed foods or full-fat milk, I don't know why adults are drinking milk. What do we have? Why are we drinking milk? Milk is for babies. Milk is for rat milk is for baby rats. Dog milk is for baby dogs. Cow's milk is for humans? No, cow's milk is for baby cows. What are we doing drinking cow's milk? If you want to drink milk, if you have to drink milk, drink a vegetable milk, drink a nut milk, drink a oat milk, drink a coconut milk, drink hemp milk. There's so many milks that are more conducive that the body can actually break down, that doesn't have all of these hormones. It's not laced with all these antibiotics, not laced with all these other harmful additives that are not easily broken down by the human system. So we don't need to be drinking milk. I know they had a really good campaign, helping people to really be deceived into thinking they need to drink milk because of calcium and all this nonsense. If they're so rich in calcium, where's the cows getting the calcium from? And if calcium is going to be such a major factor why people are encouraged to drink milk, why then does the UK have the highest levels of osteoporosis in Europe? We have the highest level of broken bones and bone fractures in Europe, and we're supposed to be one of the highest consumers of milk. So there's a lot of misinformation around drinking milk, especially full-fat milk, because it doesn't contain all the things that they're telling you that it contains. So it's not as healthy as they tell you that it may be. So be careful when you're following conventional information or information that's quite widely populated on the internet or the World Wide Web. Also, if you have obesity, being overweight, it also increases your risk of developing prostate cancer. And then, of course, exposure to environmental toxins, certain environmental toxins such as Agent Orange, which is like a preservative or an additive, may increase your risk of developing prostate cancer. If you have a lot of wheat type foods, wheat is always heavily laced with a lot of pesticides. They use a lot of pesticides, herbicides, fungicides. These things contain a lot of endotoxins, or what they call endocrine disruptors. These things actually interfere with your hormone function because they use these pesticides and sprays to spray them on the crops. And the objective is to stop them from reproducing the following season, so they don't come and damage the crops in the second season. And when you start to ingest foods that are laced with these heavy chemicals, it also starts to take up root in your system. These endocrine disruptors start to disrupt the function of your hormones in your system, in your body. So then you then start to develop a number of problems. If you're a woman, you start to develop problems like uterine fibroids, you start to develop ovarian cysts and all different types of estrogen imbalances, because these endocrine disruptors coming in from your bread, your pasta, your wheat, your couscous, they're really, really having a field day at having access to your body and interfering with your hormones. Having a quick look at MRI. This is the MRI picture of someone with prostate cancer. As you can see, with the arrows pointing, that's the actual that's the prostate and the cancer, the tumors there around that prostate. So you can see that once you've had that MRI, it's sometimes able to help you to identify what is actually happening within your prostate and the gland itself. You can see the different stages of cancer here on this sheet here. You can see stage 1, where you can see the small tumor very, very small. In the enlarged prostate, you can see stage 2, the red markers here, it gets a little bit bigger. Then you can see as it goes into stage 3, where it's a lot more enlarged, a lot more pronounced, and it's starting to move outside of the prostate gland. It's when it can start to move to other areas of the body where it starts to metastasize and start to go into other parts. And you see stage 4. That's when, if you haven't controlled it or got it under control by then, you are at a very high risk of developing some very serious complications. So what's a prostate cancer treatment? There are a number of treatment options available. Number 1, they tend to offer surgery, as we mentioned earlier. Some of the ones we mentioned for the BPH, they're not going to be as effective when you're having a situation with prostate cancer. But it's, as I say, it's always good to be preventive and to identify your status early rather than later. But once you've gone past that stage, you're going to start going into a different level of surgery, which would be a little bit more invasive and a lot more risky. So they have the surgery of removing the prostate. They also have chemotherapy, radiotherapy. You also have hormone therapy, cryotherapy, and then you have HIFU, which is high intensity focused ultrasound, another very good treatment that they're using. And the one they're using quite often as you get over the age of 60 and 70, they start to place you on what they call active surveillance, where they see you as a man with low risk. Because you can have cancer and still live, a decent quality of life. Because cancer doesn't always mean that it's the end of your life, that you're going to die. Because, a lot of times people do have the cancer gene, or they have the cancer actually forming in their body, but they're able to get on with it and live their life as pretty much as normal as can be. So that's why they've seen that in a number of people. So what they do, even though they may discover that they have cancer, they have the cancer's activity in the prostate, they'll just put them onto what we call active surveillance, just keep them, monitor them probably annually just to see if there's been any change. And they'll just be very watchful, waiting, especially when it comes to very older men. We see a lot of people like this nowadays, where they'll come in, they'll do their scan. We'll see a lot of disorders. We'll see a lot of imbalances. We'll see they're very low in zinc. They're very low in potassium. They're very low in all the vitamins and minerals that will help to support a healthy prostate. They'll have an enlarged prostate. They'll have an inflamed prostate. They'll have problems with their digestive system, but they don't feel any of the symptoms. Any of the classic symptoms we'd expect them to feel, they don't feel any of them. So when we see people like that, we'll then switch our line of questioning to say, right, so how old is your mum? They say, oh, she's late. Really? Okay, what about your grandmother? Oh, she lives to 106. There you go. And your grandfather? Oh, he was 104. So when we see people like that, this is when we know they're benefiting from what we call the long life gene. They have a very robust immune system, and they have a history of living to a very old age. And these people, when they die, we always ask them, how did they die? What did they die of? Most of the time, they'll say they died of natural causes. So when you have people that live to an old age like that, who are 100 and over, or 92, 94, 96 and upwards, these people and they're in your family, these people are what we call the people that are benefiting from a long life gene. They have a very robust system. They have a very strong constitution. It will take a lot to take them out. So when we see people like that who come in and they're very worried about maybe prostate issues or breast issues, and we find out that they have that long life gene, we say, hey, you got nothing to worry about. You're not going anywhere soon, because you have that genetic profile, you have that genetic coding that puts you in that predisposition that because your parents lived a very long age, you're also highly likely to live a very long life as well. So it's an interesting scenario. We just have to marvel at the power of God, that He gives some people that long life gene. And sometimes we pray that, God also inject that long life gene into us if we're not naturally born that way. But it's something that you can actually pray for and, you know, ask God to alter your genes so you have that longevity, and you maintain it for the rest of your bloodline. Okay, so let's look at some preventive measures. How do we prevent your status from developing? Now, we always recommend prevention is better than cure. It's always better to know your status rather than waiting till something happened or ignoring the symptoms, ignoring the signs. You've had some information today, you've known what to look out for. If you didn't know before, you know what to look out for, you know what the possible risks are, you know what the possible dangers are, you know your age, you know what level of risk you're at. But how do you then take action to prevent that from coming into the inevitable? Well, the first thing you want to do is look at having yourself booked in for a non-invasive body MOT health scan and consultation. We do a complete reproductive scan analysis where we look at all of the vitamins, all of the minerals, all of your hormones, all of your androgen, your testosterone, all of the things that affect your prostate, and really help you to really get an informed picture to help you to make an informed decision about the next steps regarding your health. So if you are, like we did a big event a couple of weeks ago with about 140 people at a retreat. It was a church retreat we went to, and myself and Glory were there. We were scanning people for like 2 days. And I remember there was a gentleman who was about 65, 70, and he had it in life. He actually had prostate cancer 5 years ago, and the doctors have been monitoring his prostate since then. As I said, they put him under active surveillance. He's under active surveillance, and we did his scan, and we identified a few markers, a few key markers that were out of range. And we said, you know what? Now that you see this thing is out of range, you are now at high risk of your cancer recurring. Your pH levels going up, your prostate becoming inflamed, and as well as enlarged. If you can see here on this trace element card here on the left, you can see the third one down from the tasting item is calcium, iron, and zinc. The zinc was very low. Also, the copper was also very low. The magnesium was a little bit low, and then the iron was a bit low at the top. Now, just having the zinc being low for a man is going to put you at high risk of developing prostate problems, because all the studies have shown that all the men, all the cases that they had with prostate cancer, they all had high levels of zinc depletion or zinc deficiency. They were very low in zinc. Every time you ejaculate, your body dumps loads and loads and loads of zinc. That's why you feel so tired after you've ejaculated. So zinc is very important to make sure you're constantly monitoring your levels of zinc to make sure that your prostate is well serviced and supported by good levels of zinc, but that really helps to maintain the health and the integrity of the prostate. So this gentleman had a very low level of zinc, and he had some low levels of magnesium and a couple of other minerals that were out of range. We also looked at his vitamin profile. If you see on the right-hand side, you can see the vitamin analysis card. Looked at the vitamin A, that means they're having problem with the eyes, because the vitamin A was low. People aren't aware of this sometimes, but the carotenoids are low. They always tell you about B12 when it comes to B vitamins, but there are a lot more B vitamins that have a lot more roles to play than just B12. So we looked at the B1. As you can see, the B1 is in the yellow. When your B1 is in the yellow, that's going to put you at high risk of developing diabetes, because it really affects the metabolism and supports the metabolism of carbohydrates. And when you have high levels of carbohydrates, that's going to put a lot of pressure on your pancreas to be able to produce the digestive enzymes to break down those foods, but your body also needs the B vitamins to help to break down and metabolize those carbohydrates. So lacking B vitamins will put you at higher risk of developing diabetes mellitus. But also, if you have B1 deficiency, you also may experience things like tingling in your hands or tingling in your feet. If you have tingling in your hands and feet, then you may also be low in B1. You can see the B2 was quite low. The B3 was okay. The B6 was okay. But if your B6 is low, that means you may have trouble sleeping. If your B3 is low, you may have a problem with your nervous system, your nerves, your arms. You may have aches and pains. Not even aches and pains, actually nervous pain, where you actually feel sensations traveling up and down your arm. If you have things like carpal tunnel disease, these are linked to your B vitamin, levels of B vitamins that you have available to the blood. Then you can also see the vitamin C was quite low and the vitamin E was quite low. Vitamin E is a very powerful antioxidant that really supports a lot of antioxidant activity within the body. So just having these identified and put them back into range, or being able to make the right decision to get the right levels of supplementation to support your body's need for those important nutrients or micronutrients, can have a significant impact on your health profile and your outcomes. But anyway, the gentleman, we did his scan, we identified all these biomarkers that were out of range, and we put him on a program of, diet, lifestyle change, detoxification, some supplementation was involved in that as well as a lot of lifestyle choices and dietary choices. And he called up, I think, last week, and he was so enamored because he was so excited because he went back to his doctor, and the doctor was asking him, "What have you done with your prostate? Your PSA levels have gone right down. How did you do this?" He was just laughing and thinking, "Oh my God, oh my God." He was, I think he told them that he'd been doing some natural remedies, or he'd been away, or he didn't give him go into detail because he didn't think that they'd understand what he'd gone through. But they said, whatever you're doing, continue doing it. Why were the doctors so astounded? They said they wanted to conduct a study. They wanted to study him to find out how at 65 or 70 he was able to get his PSA levels so low. Again, because the body was able to receive the right levels of nutrients, the right levels of micronutrients, vitamins, minerals, etc. And the body knew what to do once it had the right resources. So the preventive measures are key by helping you to know your status. What is the state of your micronutrients? What is the state of your amino acids? What is the state of your prostate? What is the state of your hormones? What is the state of your androgen, your testosterone? All of these play an important part and role in the health of your prostate. But why? By you coming to do your non-invasive scan and your men's health reproductive scan, it really helps you to identify these imbalances and put the relevant corrections and interventions in place. Prevention is better than cure. Once you've identified what the micronutrient state of your body is and what the state of your other organs are, you also want to look at what foods you could be incorporating. What are the foods you can incorporate more to make sure your body's receiving the right levels of nutrients? Because yes, it's good to have supplements, but it's also good to have the right level of food, having a balanced diet that contains the right foods and nutrients that you actually need. That's going to have the desired effect on maintaining your prostate. So you see here on the left, you can see a tomato paste, because tomato is very rich in lycopene. Lycopene really helps support prostate health because of that protein that it contains. Lycopene is a compound it contains, sorry. It's very, very helpful and healthful in case of prostate cancer. So I'm actually conducting a study now on West African men, because West Africans have a high level of tomato ingestion because they use that as a very integral part of their soups, especially when you're cooking the soup, the stew, you blend the tomatoes and the peppers. So I'm looking at what the impact of that high levels of tomatoes, which is going to make a lot of lycopene into the body, is having on the numbers and the ratios of prostate cancer in West Africa compared to the rest of the world. At the moment, the findings are showing that the numbers are a lot lower. Again, I'm not going to put it down to one aspect yet, but that is one of the areas that we're focused on because we know the impact of tomatoes on prostate health. Also, you look at the pumpkin seeds. Pumpkin seeds are very rich in zinc. As we said, zinc is a very important and powerful micronutrient that really helps support the health of the prostate. So having high levels of pumpkin seeds or pumpkin soup is always going to have beneficial effects on maintaining good prostate health. Blueberries as well. But the thing with pumpkin seeds, they also contain potassium. Potassium is another good thing because it helps not only to maintain prostate health, but it also helps to maintain good blood pressure. If you have high blood pressure, it's going to put you at greater risk of developing prostate cancer as well. Because if you have potassium helps to reduce the levels of sodium in the blood. So if you have high levels of salt, then having good levels of potassium will help to bring down the sodium levels in your blood, reducing your risk of high blood pressure or being hypertensive. Blueberries, broccoli, salmon, fatty fish. These fatty fish all contain lots of healthy enzymes and compounds that all support prostate health. Also avocados, cruciferous vegetables. You've got the grapefruit there as well, but you have to be careful with grapefruit if you're taking certain heart medicine and certain blood pressure medicine. So you've got to be careful with your foods. But because they're natural foods, if your body doesn't work well with them, then your body will automatically just eliminate them or reject them. So if you are having or on a medication program, make sure you consult your doctor before you start to make any drastic changes to your diet or introducing foods that may have contraindications to your medication. But it's always good to try and understand the type of food that you're eating to see what benefits they can confer upon your body, especially with regards to your prostate. So in conclusion, there's three main prostate diseases that need to be known. Number one is the BPH, which is the benign prostate hyperplasia. I'm trying to keep it short, so because I'm conscious of time. Number two is the prostatitis, which is the inflamed prostate. And number three is prostate cancer. There are a lot of other abnormalities or maladies that are in between, but let's just focus on the main three. We'll focus on the main three for today. Another takeaway for you is that PSA is not an indicator of the state of your prostate. It's only going to give you one part of the picture. So don't, become too overly focused on your PSA levels, because that's not the only factor, that will maybe increase your risk or reduce your risk of having further complications. So please take it as, in context, as part of the picture, but it's not the picture, although that's what doctors will maybe use to sometimes, tell you that you don't want to make a decision that you may not want to make, but just see it as just one part of the picture. It's not the whole picture. And also seek medical attention early if you find you're experiencing any of these symptoms. Don't wait until it's too late. You know what to look out for now. You know if you have problems with your urination. You know if you're having increased urination, if you're taking a long time to start or a long time to finish. These are all early signs that there may be some problems with regards to your prostate, maybe it being enlarged or it being inflamed, or it may also already be cancerous. So the sooner you start to take action, the better for you in terms of reducing your risk of developing the inevitable. So I've been the Juice Doctor. I've really enjoyed sharing this information with you today. If you want to follow me, you can do so by scanning the QR code on the screen. It will take you to our Instagram page where you can engage with our content. We have loads of testimonials of people, from men, women, old people, young people that have loads of different maladies, prostate issues, pain, back pain, joint pain, stomach issues. They're all on there giving their testimonies. So if you want to follow us on Instagram, we can keep in touch. We can, we can share information, and you can engage with some of our other platforms where we have different communities where we really encourage and empower people with information regarding their health. So thank you so much for listening. If you have any questions or for more information, you can always email us at the email address there, askjuicedoctor@gmail.com. You can give us a call on our landline. We'll get through to one of our telephonists who will take the message and pass on the information on to us to get back in touch with you. Or you can follow us on ask.juicedoctor at Instagram, or you can check out our YouTube channel, which is Ask Juice Doctor at YouTube, or you can visit our webpage, which is www.mihealthcaregroup.net. Thank you so much, OBS. If you have any questions, feel free to type them in the chat or to unmute yourself and ask away. God bless you.
In a world where well-being takes center stage, we introduce a luminary figure and true pioneer in natural health and wellness, who has transformed countless lives with his natural health expertise and holistic approach. Introducing Aaron Warden, also known as the Juice Doctor. The Juice Doctor is an award-winning clinical nutritionist, natural health researcher, detox specialist, and functional health practitioner. He's a trailblazer, an innovator, and the producer of botanical health products. You may recognize him as the star of Channel 4 and Sky TV's Supersized Kids, where Aaron took a 26-stone teenager on an emotional roller coaster to transform his life and ultimately his weight. As a social entrepreneur, humanitarian, CEO, and founder of Vivo Nutrients, Go Detox, and MI Healthcare Group, the Juice Doctor is committed to providing natural health solutions that produce real results. His mission is simple: freedom through well-being. Join us for an extraordinary and insightful well-being experience as the Juice Doctor takes us through the award-winning wellness blueprint that has successfully helped thousands achieve natural weight loss, increased energy, amazing mental clarity, glowing skin, and overcome major health challenges without medication, bad diets, or stepping into a gym. The Juice Doctor's approach to wellness is revolutionary and cuts through uncertainty by thoroughly examining all aspects of your health and lifestyle. Once the root cause is identified, nature's finest organic ingredients are employed to create an inner environment conducive to accelerated well-being from within. Don't miss this life-changing opportunity to transform your life and inspire a new perspective on health. Bring your health-related questions and get organic recommendations and enhanced food-based solutions that will supercharge your health like never before. Book in for a non-invasive scan and consultation today and get ready for a transformative experience that will exceed your expectations. Your journey to holistic optimal wellness starts today. Make sure to follow the Juice Doctor on Instagram at ask.juicedoctor and on YouTube at Ask Juice Doctor.
So you want great health, optimum vitality. With health being a global priority and inflation skyrocketing, time and money matter more than ever. So start working smarter, not harder. Introducing OxyFlush by My Healthcare Group. Natural health solutions that provide real results. You see, great health begins in the gut. In fact, the father of modern medicine, Hippocrates, said all disease begins in the gut. Over 70% of your immune system is also in the gut, so it's critically important to keep this area in optimal condition. OxyFlush helps quickly remove accumulated waste and associated toxins from clogging up the colon and preventing proper absorption of nutrients beneficial to your health. The impact is felt body-wide as immune cells are freed up to attend to other areas in need of attention. So, working smarter couldn't be easier. Clean your colon, lose weight and show off the healthier you. Powered by My Healthcare Group, makers of OxyFlush.